practitioners who's all seated here. So ladies and gentlemen, this is where we'll address all your questions. Let's take a look. Welcome back, speakers. Here we go. Thank you very much. So speakers, hi guys, thank you very much for joining us. We learned so much. All of us here in the studio, we're listening to you. So now I'll be addressing some of the questions which came in from the audience. All right, we're going to go one by one. We're going to address the question to each of you. So feel free, to answer it in your most comfortable fashion. All right, now first question goes to Dr. Chen. Now, sir, we believe that there may be some side effects. Are there any side effects of prolonged use of nasal sprays now, and when to consider seeking specialist advice for that?
Okay, so there are actually 3 types of nasal sprays. So we've got to define which one we're talking about. Just now I covered nasal saline sprays. Absolutely no side effects, unless you discomfort from shooting it wrongly. Nasal steroid sprays, I covered that as well. And as far as we can see from studies, there is no long-term side effect. Now, it's one caveat. It does cause drying of the nasal mucosa because you get less. So if you have a very deviated septum and you don't spray it and it sort of gets deposited there, it's going to cause more drying there. So if a patient already has a problem with dry mucus, bleeding, that may get worse. And that's the only situation. And the last kind of nasal spray are the decongestants. These are the ones you can buy off the counter, and they are very effective at blocking the nose. I use them sometimes. These are not meant to be used long-term. There is a condition where people love that so much, works so well, that the body becomes conditioned to having it. And the moment you don't use it, everything just goes haywire. It's like taking a drug and then becoming addicted to it. So those are decongestants. We say that use that for your flus, for your short-term sinusitis, to get some relief, not to be used long-term.
Now, so at which point do we consider seeking specialist advice?
So this is a very broad question. I think if we're using sprays, then we're thinking about dealing with allergies. So I think one situation, if you're using nasal sprays and they're not working at all, nose is still blocked, that's a situation. If you're using nasal sprays, they were working for a while and they're not working anymore, that's a situation. And the other situation, which all doctors will say, when your symptoms start to change, let's say it starts to become discolored, you get blood, you can't smell so well, and there could be some other diagnosis that on top of the allergy that the patient has had before.
Right. Thank you so much for your lovely answer. Now, next question is for Physician Lim. Now, sir, how would I know when taking TCM medicine or treatment, which takes a long time? How do I know if I'm taking it too long? When should I continue? When should I stop? Is there a guideline on that?
So TCM, it mainly targets the imbalances in the body. So there's a few diagnoses that we go as to when do we start to stop or start to reduce the medication. So first is on a clinical setting, we look at their tongue and their pulse. If it is the ideal tongue and pulse, then we can start to reduce the TCM medication. So another diagnostic requirement would be that for the next 1 month, there will be no flare up in their sinus, and they are able to, for example, stand in an aircon room for 20 minutes. They are able to eat stuff like pizza and cold drinks without their sinus flaring up. So all these will be a good indication that it will be a good time to start to reduce their TCM medication.
I see. Thank you very much, physician. All right, Dr. Jimmy, thank you very much. Now, in your presentation, you talked about floaters, and there's this viral TikTok video that came about recently. Saying you see floaters, and something is really wrong, it's really serious. So we're glad that you managed to to talk about it. Now, the question is, how do you manage eye floaters and flashes? Or family members with any glaucoma history?
Okay, let's just tackle first part of the question, floaters and flashes. Now, floaters and flashes are very common in patients' eye, and I have floaters myself. Now, floaters that you see on a daily basis and the numbers are always about the same, those are regular floaters that is because of degeneration of the vitreous gel. Now, those floaters that are more sinister, they tend to have a lot, hundreds and thousands of floaters suddenly coming out of nowhere, something blocking your vision, constant flashes of light, and that's when the vitreous gel is pulling on the nerve and there may be a damage to the nerve. So in those situations, you need to see an eye specialist as soon as possible. Can you really manage floaters and flashes? The answer is probably not. You probably get used to it. Like if I look at you now, if I pay attention, I can see a couple of floaters in my eye, but if I ignore it, it just kind of goes away. Now, the second question goes to, if a family member has a glaucoma history, so it's very important when someone has a family history of glaucoma to get themselves checked. Well, I guess it's also dependent on how young or how old the person has glaucoma in the family members. The younger the family members have glaucoma, I think the earlier the person should go for a check. I mean, in general, we advise people above 40 to to go for a glaucoma check. But if you do have a very strong family history, everybody in the family has, and someone is blinded by glaucoma in the family, please go and see an eye specialist as soon as possible because there's really no symptoms at all.
Well, there goes a good reminder for us. A lot of us, we go for health checks for other stuff, but glaucoma checks above 40, if there are some relevant symptoms, go for a check. Why not, right? All right, now, Dr. Chen, this is a very popular question, I think, because a lot of us have sinus, but how do you resolve chronic sinus problems in children and teenagers? It's a...
I think this question brings up the difficulty we have when patients describe sinus. So I'm guessing that a chronic sinus problem in a child and teenager is most likely going to be allergic rhinitis. So as we talked about it, actually the only way to finally resolve it, some people are lucky they grow out of it, meaning their immune system becomes better regulated for whatever reason. But otherwise, immunotherapy for children, teenagers, I think that's the way to go because they have such a number of tens of years where they might still be suffering from it. And at that age, if we can cure it, we probably have an 80 to 90% chance of curing with immunotherapy. That might be a good way to treat it and give them a head start for the future. For very small children, like primary school age, sometimes this sinus problem could be recurrent upper respiratory infections. And if they have a big adenoid, you can imagine that chunk of tissue there that gets inflamed. It takes so long to settle down each time. Besides the usual medical treatments and sprays, sometimes they may be better off having that adenoids taken out surgically.
I see. So consult your specialist to find out more. All right. So, okay, now next question, Physician Lim. How can TCM address issues with the deviated septum? It's two different worlds.
So unfortunately, TCM would not be able to correct the structural defect. But what TCM can help is with the secondary consequences like the post-nasal drip, the inflammation, the congestion. So that is where the TCM will shine, so as to say.
All right, thank you very much. There you go. All right, now next question. Dr. Jimmy, how do you protect eye health or individuals who work on laptops and stare at monitors day in and day out?
Yes.
I see. I have an answer for that. So don't stare so long.
Yeah, so you're the doctor already. But, well, it's true. I mean, most of us look at these laptops, and me included, all the time, or look into microscopes, and we use our eyes all the time. The first thing we do when you wake up in the morning, we use our eye. Well, I think the simple thing to remember is 20-20-20, right? Doing something for about an hour or two, take a 20-minute eye break. Stare at something 20 feet away, and just and maybe just every 20 seconds or so, just blink, relax your eyes, and just make sure you're comfortable. There's no real way of protecting your eye health for individuals working on laptops or stare at monitors, because that's what we do with our. It's a function of the organ. But if your eyes are feeling dry, if the eyes are telling you that I'm not comfortable, put some tear drops, put some eye drops. If you're finding that you've been blurring your vision and you're blinking a lot and you're rubbing your eyes a lot, just get it checked to see if there's any allergies or so.
That's very interesting. Now, Dr. Jimmy, you talk about 20-20-20. Can you just bring us through a very quick, what's the SOP for 20-20-20? Every 20 seconds, is it?
Yeah, I mean, I would like to say that, try and blink.
Blink, okay.
Blinking is important. Take a 20-minute eye break. Stare about 20 feet away, and then you feel a lot more comfortable after that. Don't just keep going through the day on a laptop,
Yeah, some of my friends here in the studio have been looking at the laptops for more than 1 hour now. Guys, can you take 20 feet away right now, please? Guys, step away. 20 feet. All right, now, guys, next question. Let's take a look. Okay, now, Dr. Chen, how do I know if I'm having sinus or having a flu? That's part one. Part two, I tend to have bad sinus on a monthly basis. How do I resolve that? Now, first question, sinus or flu?
I think, again, the sinus in this case, look at your daily pattern. If it's the same thing, it's a runny nose, sneezing a bit, and then 3 hours later you're better, that's your normal pattern. So that's what sinus, but I call allergy, right? Allergic rhinitis. If you're having a flu, and we've all been through this, you feel sick, something is different. You feel tired, there's a bit of a sore throat, and you think that, okay, I'm sneezing a lot more now, but later in the afternoon, at the night, it still doesn't get right. So it's either a very bad bout of allergy or you've got flu. More likely it's got to be a flu. I think that's, yep. Second one, bad sinus on a monthly basis. I'm suspecting this person actually is talking about getting recurrent upper respiratory infections. And how do we resolve that? I think you need to see a specialist to check. Sometimes we need to look at whether their underlying conditions like allergies are not being well controlled. Is there a need to check on the immune system? I think, and sometimes just to make the diagnosis, because some patients might just be getting bad bouts of allergy every month, they think, and mixed in with infections, it's sometimes a bit hard to tell. You've got to see the doctor when it's happening to try to figure it out.
There you go. And everyone has a different body. You need to have the specialist to look at you to have a customized plan for you. All right, so next question, Physician Lim. Can TCM totally cure sinus?
So the definition of cure from the TCM and Western perspective would be a bit different. So if we take the previous question, deviated septum. So from the Western perspective, the cure would be like the septum is entirely straight. Yeah, but from the TCM perspective, it's technically cured if the symptoms doesn't flare up. Yeah, so, and the way we go about it is to adjust the body and hopefully get the body to self-regulate better. Yeah.
I hear you. Thank you very much, sir. Dr. Jimmy, to you now. What are the preventive measures for glaucoma?
No, I don't think there's really a preventive measure for glaucoma. You really cannot prevent glaucoma from happening to yourself, me included. Now, what could be secondary glaucoma that you can prevent? Yes, eye injuries. You have eye inflammations that's chronic. Those are the glaucoma that you can prevent, because they have a reason for it, like chronic use of steroids. Those are preventable. But majority of glaucoma per se is, kind of predestined by your genetics. Right. So you really cannot prevent glaucoma per se. So you really have to get it monitored or checked, rather than say, I would like to prevent it by doing some sort of exercises in the morning.
Got it, doctor. Thank you. All right, now, Dr. Chen, how do you speed up recovery of sinusitis?
Okay, listen, I've gone through this many times, so I've got the perfect recipe for it. Okay, when you first detect it, you got to prevent the buildup of the mucus and the clogging. So that's when you use the decongestants. Everyone knows this already. One other big secret, and I tell 10 people, if even one person takes it up, that's of value. Because the nasal saline irrigation, it clears those clog points and it helps to improve the recovery time. But what Physician Lim said as well, if a patient feels better, and you know that you're just washing it, it's going to have effect for a couple of hours and then it builds up again. But those few hours feel different. And I think that cumulatively helps. I'm not going to talk about antibiotics because that's already done. So I think these are the two big tips that I would have. I do it personally and it works.
Right, there you go. That's very good advice. Now, Physician Lim, to you now. Is sinus linked to heatiness or body constitution?
So actually they're related because the body constitution or the body pattern, they include heatiness. So in the slides just now, there's like the wind heat, there's the wind cold. So all these are just reflections that the body, there is some imbalance in the body. And in some individuals, that imbalance might manifest itself as heatiness. So the bottom line is, rather than looking at heatiness per se, we, as TCM physicians, we focus on the body constitution, the pattern, whichever they might be, and then seek to correct this imbalance.
I see. Interesting. Thank you very much. Dr. Jimmy, interesting question here as well. Now, what simple massage techniques are suitable for elderly experiencing eye symptoms such as watery eyes, irritation?
Well, there's neither simple nor complex massage techniques that are suitable for the eye, to be honest with you. Most people just rub their eye because they are uncomfortable.
Like this?
Really just because they are, reacting to the symptom. Don't do that.
Don't do that.
Don't rub your eye. Don't massage your eye, because there's really no such technique. Now, for elderly experiencing eye symptoms such as watery eye or irritation, there may be something else. Maybe chronic dry eyes, inflammatory dry eyes, or there may be a tear in the cornea. So there are many diagnoses for watery and irritation of the eye, but having a massage technique is not the answer to that.
There you go. Once and for all, right? There's no massage techniques for that. Okay, cool. Dr. Chen, some ENT concluded sinus issues are associated with food allergies. Some food allergies may bring out ENT symptoms. So how do you enjoy favorite food whilst preventing sinus outbreaks?
Okay, this is quite a tough topic to talk about because the evidence for food allergies related to sinus issues is there's not a lot of it compared to our other studies. But to me, this doesn't mean that it doesn't exist because there's so many people that we see where they can see a pattern with what they're eating and what symptoms they get. So I tend to look at a more TCM holistic way when I'm talking to these patients. I do all the necessary things to rule out the obvious things that they have. If they don't have it, the tests are negative, and they have a pattern of food association with symptoms, then we try to explore that. And we assume, yes, there's something going on in the body. There's some inflammatory allergy thing going on. The nose or the skin or whatever part of the body is a manifestation of it and spilling out. So that's a sign. And the simplest thing is don't overeat those foods. If you really need to have it, and if the main symptom is a runny nose, then just take an antihistamine preemptively, spray the nose preemptively, and then enjoy the thing and minimize the side effects. That's my advice.
There you go. There you go. Thank you very much, sir. Okay, now let's make our way to the next question. Physician Lim, now how can TCM help improve my sleep, especially since I wake up with sinus issues every morning?
So from
TCM perspective.
So from the TCM perspective, sinus issues, poor quality sleep, all this boils down to the root, the core issue, which is the underlying imbalances in the body. So in TCM, we don't just focus on like the symptoms per se. We try to go down to the root of the issue. So there are many symptoms. There are many underlying imbalances that can affect this, from a weakened spleen. All these are all potential imbalances in the body, and when corrected, the resulting symptoms will then resolve.
Right, thank you very much. Thank you, Physician Lim. All right, Dr. Jimmy, how do we reduce eye floaters? How do you manage eye floaters with short-sightedness and long-sightedness at the same time?
Okay, so I'll help them rephrase this question. How do you reduce eye floaters? Eye floaters cannot be reduced. It's something that you are already found inside the vitreous gel of your eye. It's not something that you can do take some medication. Some people touted the fact that lasers can reduce the number of floaters. I usually do not recommend lasers for such things. They're not known to be very effective. Floaters are something that's found in your eye. It's an entoptic phenomenon, but you actually get used to it in your eye, and your brain will tell you that ignore it, it's just noise. I'd like to rephrase the second question. How do you manage floaters with short-sightedness and long-sightedness at the same time? Because they are quite different things. Floaters are, of course, associated with short-sightedness and presbyopia. They're not causative of it. They are not the cause of your short-sightedness or your long-sightedness. The long-sightedness is something of age. Short-sightedness is something that you grow up with. And floaters is something that is found in your gel that is degenerate as you age, regardless of the fact whether you have old-sightedness or long-sightedness. To manage eye floaters is what I've said, that you have to monitor the symptoms. If you have more floaters and more than usual, or vision becomes worsening, please see an eye specialist. For short-sightedness and long-sightedness management, if there's another question, we'll answer that later.
There you go, different schools altogether. Thank you very much, sir. Thank you. All right, now, Dr. Chen, in what situation does a plastic surgeon needs to work with an ENT doctor on sinus surgery? For example, my ENT doctor did septoplasty on my nose after my sinus surgery. It's a very specific question.
Okay, so we have to think about the anatomy, so it structures then. Sinus surgery does not involve a plastic surgeon at all. A septoplasty, which is the first operation I was covering, where it's all internal, actually does not need and should not involve a plastic surgeon at all. When you're dealing with a nose that's very crooked, and it can be seen generally on the front or the basal view, and that requires some sort of adjustment and grafting, sometimes it can be of value to work with a plastic surgeon. The thing is that we need to look at it at the anatomy. When we do an open septorhinoplasty for a functional reason, a blocked nose, everything is open there, and the best time to do anything that you want to do is at that point, so we can make it straighter. And by making the nose straighter, actually the tip may look in a better position, the nose is straighter, there's more symmetry. But sometimes patients say, at the same time, I want my nose bridge to be higher. Can you do that? And that is the perfect time to ask the question. It doesn't mean you need a plastic surgeon to do that. The surgeon that you, as Dr. Jimmy was saying, as long as the surgeon can do what you want him to do, that is good enough. But there are complications in any system. If you are involving cosmetic portions of the operation, then insurance won't cover that. So those are all things that you need to discuss with the surgeon. Yeah.
Thank you very much, sir. Thank you. All right, now, Physician Lim, besides acupoint massage, what herbs can I take to drink to relieve my sinus?
So previously covered in the slides, there are some teas that we can incorporate it, but of course, whether those teas are suitable for you, it depends on the pattern. So if unsure about the pattern, it will be best to to consult
A consultation.
the physician. Yeah.
Because everyone's constitution is different.
Yes.
Got it, sir. Okay. Dr. Jimmy, preventing presbyopia and constant twitching in eyes. What's going on?
Okay, let's answer the first part, which is preventing presbyopia. I always say in jest, and I always joke with my patients, how do you prevent presbyopia? Just don't blow your birthday cake, that's all. Don't age. That's the reason that you have presbyopia. Everybody has to age gracefully. There's no way that anybody can prevent presbyopia. Can we treat presbyopia with the different type of lenses that we have? The answer is yes, but presbyopia is a factor of time. It's not a disease, it's not pathological, it's just how you grow. All right, so there's no prevention, but yes, it can be managed subsequently when we change the lens. Constant twitching in the eye is a different thing from presbyopia. Constant twitching in the eye is when I think most people will experience some sort of twitch in the eye. Those are very common. This shows a sign of fatigue. Most of the time, the muscles around the eye are very tiny and small. It's like you go to the gym and you carry very heavy weight and your muscles start twitching. That's exactly what's happening to the eye. Usually found in patients with uncorrected vision and they are squinting all the time. Patients with a recent viral disease or some sort of inflammation of the nerve. Patients who have too much caffeine, late nights, not enough sleep, chronic fatigue syndrome. These are the most common causes of twitching in the eye, and that's what's going on. But when would I be worried about twitching in the eye? Twitching in the eye just goes away with time. Some cold compress, make yourself more comfortable, and you'll go away. You worry about twitching in the eye when it spreads to the rest of the face. When your face starts twitching and your lip starts twitching, we are worried that the nerve is being compressed by something. So when that starts moving or progressing, yes, please go and see a specialist as soon as possible.
I see. So it's nothing to do with someone thinking of you. Because, when it's twitching, someone's thinking of
That
you.
as well.
That as well. That's mostly it, right?
Yes.
Mostly. Right now, Dr. Chen, for the last 2 to 3 years, I've been having sneezing and runny nose in the morning, which lasts mostly 15 minutes to half an hour. And sometimes longer, mostly after taking showers. So after shower, he has it as well. So if I don't sleep in the aircon room, then it doesn't appear. The issue started about 2 years back and it keeps coming back. So what this person is saying is that probably the aircon is contributing to her having sneezing and runny nose. What's your thoughts on it?
Okay, so actually, our first measure in allergic rhinitis is avoidance. So if we just said, don't sleep in aircon and don't take showers, but that is absolutely not going to work. So that's why the question is being asked. So we don't know the age of this patient, but there are also non-allergic types of rhinitis. So a patient can have both. The usual story for 15 minutes and all that maybe sounds like allergy. But then we think about it. Once your whole system is set up to be reactive, any other trigger will have a bigger reaction, right? So you have dry wood, you throw a match, it's going to burn. If you've got moist wood, nothing's going to happen. So I think that's what's going on here. And if we want to target, okay, we don't know if this patient is taking medications. You could start with antihistamines. You could try to treat all that as we talked about earlier. But if that doesn't work, then what do? Look at the environment, anything we can change, not really. Perhaps if it's just runny nose and sneezing, we talked about cryotherapy. We don't know the cause, but we can disable the output side of that equation. Maybe that will be something to consider. But of course, this needs to be looked into more detail.
There you go. That's a great answer, by the way. So thank you very much, Dr. Chen. All right, now next, Physician Lim. How can you help with sinuses at the clinic? I think we covered that before previously, huh?
So at the clinic, when we target sinus, after identifying the underlying imbalance, usually the two main modalities would be herbal formula and followed by acupuncture.
There you go, herbal formula and acupuncture. Thank you very much. Dr. Jimmy, I've been using eye drops daily for my dry eyes. Now, does lutein supplements help with this condition? If not, any recommendations?
Yeah, so if you're using eye drops daily for your dry eyes and it's you're managing poorly, I mean your eye drops frequency is very high, I suggest you see a specialist. But if you're managing well, occasionally you're using the eye drops, that's perfectly fine. Now, lutein supplements are actually the building blocks of the retina. They're actually used for age-related macular degeneration or retinal degeneration diseases. So lutein supplements do not counteract with the conditions of dry eyes. Sometimes in dry eyes, we recommend omega-3, high concentration. That really treats the inflammation of the eyelid margins so as to improve the tear film quality. So if any supplements for dry eyes, usually it's omega more than lutein.
I see.
Yeah.
All right, so definitely not lutein. All right, now, Dr. Chen, my apartment is next to Bukit Gombak Forest. This is the property agent question. Yeah, my apartment is next to Bukit Gombak Forest. So is it due to pollen? Earlier I was... Okay, so I think he or she is having some allergic reactions after staying next to Bukit Gombak Forest. So is it due to pollen? Because earlier she was staying elsewhere and she didn't get it.
That's a possibility. It's not so common in Singapore. And it usually takes about 3 to 5 years to develop an allergy, actually. So I think this situation requires testing, and maybe there may be some other factors about this. It's not impossible.
Yeah. Testing is the way to go from here. Yeah, awesome. All right, Physician Lim, is herbal medicine or acupuncture more effective for treating sinus issues?
So in the clinical setting, usually it's a combination. So herbal medicine is more to help with the inner imbalances in the body. So acupuncture is more for symptomatic relief. If the congestion, if the pain is severe, then usually we'll do acupuncture to bring about faster relief, and then for long term using herbal medicine to adjust the body.
There you go. Thank you very much for that. Dr. Jimmy, how can we manage and relieve tired eyes? Products or tools that can help, like heated eye masks, is there any recommended frequency and do they work?
Yeah, so to relieve tired eyes, I would say that tired eyes usually is due to dry eyes. Long-term use of your vision, using laptops, you find your eyes to be very dry. And more often than not, is the fact that there's a lot of evaporative losses. That means the tear film does not stay on your eye for a long time and evaporate very, very fast. Yes, using heated mask, sometimes we use heated mask to treat the lid margin, but there's not actually a recommended frequency for that. I'm not so much a doctor that recommends too much gadgets for my patients. I usually like to diagnose them and see what is actually the cause of it. Even though it's dry eyes, it could be many reasons. It could be lid margin issues, it could be evaporative loss issue, it could be production of the tear film issue. So I would say for symptomatic relief, yes, you may use a heated eye mask, but I think it's also good to look at the root cause of the problem to get this sorted out. Yeah.
Is there such thing as too much eye drops though?
Yes, there is actually. So some eye drops actually contains a lot of preservatives, a lot of over-the-counter. A lot of my patients love to go to Japan and come back with crystal-like bottles and say, oh, I got this really nice bottle of eye drops. They love it because it's so beautiful. But it contains so much preservatives that as you put in your eye, the preservatives itself is toxic to the surface of the eye.
It's bad.
Yeah, so they come with other eye problems. Why are my eyes red after a while? Yeah, of course, because of the toxicity from the preservative. So most of the products that I use either have very mild preservatives or no preservatives at all. And in those eye drops, yes, you can use it at a higher frequency, more than 4 or 5 times a day. Yes, but with the preservative, yeah, once a day maybe. Yeah.
I see. That's good advice. Thank you, sir. Thank you. All right, now with 5 more minutes for the rest of the questions. Now, Dr. Chen, may I know if it's fine? Is it fine for children under 5 to be on puffs like the Flixotide or Ventolin for hypersensitive respiratory tracts?
Very good question. Before I answer, I just caveat is that this is probably asthma or reactive lower airways. As an ENT, we don't primarily deal with that, but they are associated with allergies as well. So broadly speaking, from working with our pediatric colleagues, if the child is getting asthma or recurrent bronchitis, those symptoms are obviously more severe than the potential long-term side effects that one might consider. But this kind of situation needs to be worked out because it is true that high dose inhaled steroids, not nasal steroids, can actually affect the balance that I talked about in very, very high doses. And those things can have some effects. But then in those situations, the question is what's worse? Suffering severe asthma that could be very, very bad or these other long-term side effects. So that would be my answer to this question. And again, looking from what Dr. Jamie said and Physician Lim as well, if there's a possible way of finding an underlying reason for the person getting these symptoms, then I think that treatment should be targeted towards that eventually.
Thank you very much, sir. All right, now, Physician Lim, or rather, Dr. Jimmy, what treatments are available for severe digital eye strain? Now, we'll be receiving all the questions like this for you today. Yeah. Right? I believe these are common problems that
yes,
all of us have.
Yes.
So what treatments are available? Not able to look at digital screens. Yeah.
So this is real. I mean, there are people who actually come and see me that they aren't able to use their laptops anymore and digital laptops anymore. It's real, and patients come in with eye patches, wearing caps and everything for the past 1 year. And those patients have very severe eye inflammatory conditions, which they mimic dry eyes. So if you have such severity, I don't think it's something that you would want to self-treat. You really should see a specialist to see if there's an inflammatory component to it, or is it a poor tear film component to it. There are a lot of things that we can do now with anti-inflammatories for the eyes and a tear film replacement. So there's a lot of things that we can do, but this sounds more severe than a curbside consult.
Yeah. Go for a professional, please, right? Professional consultation. All right, now, Dr. Chen, I'm sensitive to steroids. Not sure if going through surgery would be an option for me. It's rather general. How do you make of this?
Unfortunately, I can't really answer the question because the steroids, I'm not sure if it's a spray steroid or oral steroids, and the kinds of surgery could be related to acute, chronic, or nasal polyps, or even allergies, so it's a bit hard to answer this question.
I apologize, but I wish your questions can be more specific for us, but thank you very much. Moving along. Now, Dr. Jimmy, causes of dry eyes are more intense under indoor aircon conditions. And are there any kind of food you recommend for improvements to help dry eyes or in intense aircon conditions?
So in air condition, like PSLE questions, my kid is taking PSLE because the environment has low humidity. So evaporation takes place very fast, and then the wind, the breeze, and evaporation takes place very fast. That's the reason why you probably have dry eyes in a very intense wind condition or a colder, dry condition. Food that you recommend for improvements, I think it's just water. Hydrate. Please hydrate, sleep well, hydrate, exercise, take some vegetables and fruits. I think that's a simple things that we could do for ourselves.
Very good advice.
Basis.
No magic potion. Back to the basics. Water, sleep, good health. It's amazing. Thank you, sir. Dr. Chen, is it common for a child to suddenly develop allergic rhinitis at age 10? Did I pronounce it correct?
Yes, allergic rhinitis.
Yeah, rhinitis.
I think it's entirely possible, and sometimes that suddenly relates to an acute infection that doesn't seem to go away. So it's brought out something that was already surfacing, and by the time they come to see us as specialists, usually it's something that's dramatic, because our GP colleagues actually treat the vast majority of allergic rhinitis very well. Yeah.
There you go. So yes, it is common. All right, now, Dr. Jimmy, can you explain what are the causes of left eye CSR? And how does it occur or will it recur?
Okay, CSR is like what they call choroidal retinopathy, serous retinopathy. So it's a very long name for a bleb that forms underneath the macula of the eye. These patients tend to have a type A personality, a stressful lifestyle, and maybe even on exogenous sources, external sources of steroids. So those are the possible causes of CSR, but not all-encompassing. Will it recur? The short answer to that is yes. Yes, it may recur. So see a specialist for that as well.
See a specialist. There you go. All right, now, ladies and gentlemen, that's all the time we have for today. And of course, we thank you very much for your questions. We are sorry we can't get to all your questions. You guys have been very enthusiastic. Every segment, there are a lot of questions, so we really thank you very much. Most importantly, we greatly appreciate you spending your lunch time with us, and we hope you found this webinar useful. Now, once again, heartfelt thank you to Dr. Chen, Physician Lim, and Dr. Lim for taking the time, for sharing such valuable insights with all of us. We definitely learned a lot on how to stay healthy today while protecting your tomorrow. Now, before you go, for those of you here, ladies and gentlemen, it's going to mean the world to us if you can help us share your feedback. All right, take a look at today's QR code, and if you can tell us more about today's webinar, help us improve so we can be a better you tomorrow for you. So if you can share with us what topics you'll be interested in the future, all right, so we can keep a lookout for future invites. Do share your thoughts on what interests you, all right, so we can bring those doctors or professionals to the webinar for you. Now, the first 20 participants, now this is interesting, the first 20 of you to share your feedback will receive a $10 Grab transport voucher, all right, and I think it's really going to help because, oil costs are high now. All right, so please do share your feedback. The first 20 of you is going to get that Grab voucher. So let's take a look at the QR code right now. I'm going to give you some time to scan the QR code, share your feedback. First 20 of you walks away with a $10 Grab voucher. And then, Final 10 seconds to go, and it's been a great time with all of you. This is the first webinar. We're expecting a few more to go this year. We hope you can join us for the rest as well. Remember to tell us what you're interested in so we can bring the relevant people to you. All right, now, ladies and gentlemen, again, we'd like to share with you on what our friends from Yu Sun has for you. Let's take a look. All right, again, we've covered this before. I'd like to share it again. We have for you the TCM consultation and the acupuncture bundle for $58 only for first-time patients. And of course, or a $0 TCM consultation again for first-time patients. All you have to do is to just share your webinar EDM screenshot to redeem that. And again, if you'd like to have more information, do scan the QR code to find out more. Before we wrap up, very, very importantly, we're excited to share with you an upcoming public forum that's called Lessons for Life. Cancer Care Conversations. Now, this is jointly organized by Mount Elizabeth Hospitals and Parkway Cancer Center in Singapore. It's just a one-day forum. It's happening on next Saturday, 18 April at Pan Pacific, Singapore. On the program, will bring together medical expertise and real-world perspectives, empowering individuals with knowledge whilst highlighting the importance of multidisciplinary, patient-centered care. You will also hear from patient advocates and caregivers sharing their journeys alongside insurance professionals who will provide guidance on navigating the financial aspects of cancer care, which can be very tricky. All right, tickets are only priced at $10 with proceeds supporting the Singapore Cancer Society. You can look forward to lunch, on-site mammography, interactive activities, goodie bags, and much more. All right, now please do scan the QR code to find out more. It's happening Saturday. Ladies and gentlemen, and now back to my friends here, the professionals. We thank you very much for your time. We'll be flashing the details of our speakers on screen in just a bit. Now, this webinar is proudly brought to you by iXchange, your trusted TPA and medical services provider. Please do email us if you'd like to have further inquiries on today's webinar. We hope everyone stays safe, healthy, and happy. So thank you very much, guys. See you soon. Bye-bye. See ya.